The Shift Partner is this in-house innovation fellows and one of our anaesthetists from Broomfield Hospital, who was on the NHS Digital Academy and had an idea about how you could make theatres more appealing for people to work bank shifts. Largely at the time, Broomfield Hospital had vacancy factor of about 56% in theatre staffing, and no matter what the pay rates were, it wasn't necessarily helping. So Dilshan Arawala is our fellow. He decided to think differently about how the shifts were offered, and it led him to develop this digital tool called Shift Partner. What it does, what it continues to do for us in our ITUs and in theatres, is personalised rostering and scheduling. So it offers people the shifts based on their role and their skills and their interests, rather than just what's available in any given week. And it uses into artificial intelligence, well, fancy word, a bit of machine learning really, to learn from that, and then to push shifts out according to skill mix and preferences, so that we're more likely to get people to take up bank shifts the first time rather than use agency. So what we did was we essentially built with Shift Partner a scheduler, booking and scheduling app. So at the time we had 3 drive-through testing facilities, and we had the facility for some very limited direct testing for patients at home. And we needed a way that people could, I've got symptoms, or I've been, I think I may have COVID. How do I download, book onto an app, create a slot, turn up at the drive-through, scan my app, get my test done, and then I get pushed my result. And what we did was set up a process whereby the result would come to you if it was negative. If the result was positive, then a health advisor would ring you up and explain to you that your test was positive and what to do about it, and to make sure that PHE advice and so on was being followed. So it's now 2 days, which is might not seem a huge improvement, but when you're relying on those staff getting back to work as soon as possible, then improving that timeline is very important. So we already had an in-house system that we knew was stable and reliable, and a familiar brand to many of our staff. We're now delivering over 4,000 PCR tests and 12,000 antibody tests, so serology testing for all of our partners. And this has shown we now have about 400 staff absences due to COVID-19 contact or symptoms. We've also successfully, or Dilshan I should say, successfully sold this, so it's also been purchased by Norfolk and is currently in the process of negotiating another contract with a trust in the east of England. So, and as you can see here on the left, this is huge. Seen our productivity and testing increased absolutely exponentially, and we were able to do, I think we did about 1,200 serology tests on the first day of serology testing. The staff were able to use Shift Partner to book, to confirm their identities, receive their scheduled appointments and the location for testing, and also receive them, then get an email back with their results. So we obviously worked closely with our in-house IT, and now we've been able to integrate it with WinPath, which is our pathology results, and our obviously the automatic upload of NHS numbers, which was additional investment into the product, but has been justified because now we're doing several thousand bookings every day. It helps to improve the traffic through the app. And a lot of adaptation as we went along, both from the developers, from Dilshan himself as a fellow, and the users, to make sure that it was improving all the time.